Now, the Health Department has just spent another £49 million to maintain a stockpile of the antiviral medicine Tamiflu. The drug was first introduced 7 years ago because of fears of a flu pandemic. But today, MPs criticised drug companies over their failure to publish the full results of clinical trials for drugs like Tamiflu. Our health and social care correspondent Victoria MacDonald reports.
Coming off the shelf every year, hundreds of millions of drugs prescribed by UK doctors for their patients, all handed out with the assumption that they are safe and that they work. But today, an influential committee of MPs has attacked the pharmaceutical industry for routinely withholding information on the trials used to develop these drugs.
Essentially, I think it's now time to make sure that when pharmaceutical companies do trials, they put all trials on all uses of all treatments into the public domain so that they can be criticised and that other people can look at them as well. We should have no doubt that there are extremely large vested interests here, people who make a great deal of money out of drugs, whether or not they are as effective as they are claimed to be. And it's very, very important for the public, not only for the safety of the public, but also for the best use of taxpayers' money, that we get better at this.
Indeed, today's report cites research that suggests 50% of all trial results are not published.
Flu viruses can spread if you don't catch your coughs.
The committee points to the antiviral drug Tamiflu, manufactured by Roche and stockpiled by the government in the event of a swine flu pandemic.
So far, the government has spent more than £500 million on Tamiflu, 49 million in the past year alone. But today's report points out that because Roche did not publish all the data from all its clinical trials, there remain doubts over whether the drug actually works as efficiently and as effectively as has been claimed.
In fact, an assessment in 2012 by a group of academics of some of the Roche data questioned the value of stockpiling the drug.
We could find no evidence, or credible evidence, that it interrupts transmission of the virus, which is the foundation of the stockpiling, or the scientific foundation for stockpiling the drug.
In the past few months, Roche has now finally handed over all its data to the Cochrane collaboration, and the results will be published later this year. In a statement, they said,
"We stand by the integrity and robustness of the data that supports the efficacy and safety of Tamiflu. We support the call for greater transparency in access to clinical trial results."
And the Department of Health said it would take into account any changes in the evidence before replenishing future stocks. But today's report is about all clinical trials and all drugs. And while pharmaceutical companies have begun to respond to calls for greater transparency, there is still no move to publish all data.
What probably has the potential to make the biggest difference to current medical practice is getting information from old trials into the public domain and available to researchers to independently scrutinise, because the vast majority of medicines we use every day came on the market decades ago.
Today's report is about the best use of public money. It is, after all, from the Public Accounts Committee. But the academics and scientists calling for more openness say what is most important is the patient and knowing what is the safest and the best medicine to give them.